Hi guys, so I did my presentation on nasogastric and nasoenteric tubes. This is from chapter 13, it was additional medical procedures. And I really chose this topic because it had so much information in the chapter, so it was easy to get all the information. So what are they? They both are made out of polyurethane, silicone, or rubber. And then the nasogastric is used mostly for diagnostic exams, feedings, medication administration, treat intestinal obstruction, control bleeding, and then the nasoenteric are mostly used for decompression, diagnosis, and treatments. And then here's a little baby with nasogastric tube. So here are some common nasogastric tubes. First is the Levin. It's very simple, 1 lumen, it's plastic, goes through the nose into the stomach. I did my art project on this one. And it's used for gastric decompression. Then there's the Sump that has 2 lumens. It's radiopaque and has a plug pigtail, and it allows air to the stomach, and it's used to drain fluid from the stomach. The Nutriflex is 1 lumen, and it's mercury weighted tip, and it's covered in gastric secretions with lubricant, and that is used for feedings, which is kind of, you can tell in the name. Then we have the Moss, which is a 3 lumen, and there's a balloon to anchor into the stomach, and the 2nd and 3rd lumens are used for aspiration and feedings, and then the other lumen is used for aspiration of fluid and duodenal feeding. And then lastly, the Senstaken Blakemore is also 3 lumens. It's a thick catheter, 2 balloons for pressure, and it's used to control bleeding from esophageal varices. So the common nasoenteric tubes. We have Cantor, 1 lumen. It's a small mercury-filled bag at the end. It has drainage holes for aspiration, and it's used to relieve obstructions in the small intestine. The Harris is also 1 lumen mercury-weighted tube, goes through the nose and moves through digestive tract by gravity or peristalsis, is that how you say it? And used for gastric and intestinal decompression. Then lastly, Miller Abbott, 2 lumens, and it's a small caliber catheter. One is a perforated metal tip, and then the other has a collapsible balloon, and it's a radiopaque tube used for decompression. So here I just wanted to put this image to show a double lumen compared to a single lumen. So here's the one connects for drainage, and then this is the air vent. And then this is the lumen, which is very simple, it just has the one opening for suction. And then obviously the 3rd lumen tubes would have just another one of these. So the insertion and passage of the tubes. So it's inserted through the nasopharynx and into the stomach, duodenum, or jejunum. The nasoenteric can pass into the duodenum and small intestine through peristalsis. And this is actually an image of that. It's just the muscles contracting on their own so the tube can move down. If the patient has a reason that it can't enter through the nose, you can go through the mouth. Sometimes doctors will anesthetize the area through the nasal passage or through the mouth, and they don't do that all the time, but it can be done. And then they're placed in the fallow position, and the end is lubricated, and the patient's just told to swallow as it's passed. So a lot of the time x-rays are done to ensure that it's placed right, but it's not done all the time. And if it's in for a long time, placement can be checked by attaching the end of an NG tube to a 20 to 30 milliliter syringe and pulling out gastric fluid. And then you place that fluid on the litmus paper to check for the acidity. And if it's right, then the pH will be through 1 through 4. So patients with gastric tubes cannot eat or drink without the physician's orders, so never give any water or anything like that. And then to reduce the risk of aspiration, keep patient in a semi-fallow position for 30 minutes after anything is administered through the tube. And if you suspect anything wrong with the tube, you need to get assistance immediately and be ready to help section. And here I have an x-ray of a correctly placed tube. You can see it going into the stomach. And this one is pretty obvious. You can tell it's all tangled up right there in the esophagus. So transferring. So the tube may be attached to suction that is portable or piped into the room, and the suction is just as the patient needs. And so before making the transfer, verify the physician's orders so you know the pressure and if they can stop for how long and whatnot. So if it can only stop for a short time, take the patient's portable suction with them or just use the suction at the x-ray department. And make sure you know the amount of pressure, like I said, and then the max amount of suction is the pressure equal to 25 millimeters Hg for an adult. Leave. If the tube is a double lumen, never clamp it. It could destroy the effect of the tube. Removing the tubes, pretty simple. So those tubes that are in the stomach are removed really easily. They just slowly pull it out. Leave the tube in place. And we, as techs, can never remove nasoenteric tubes, but sometimes we'll assist the nurses with removing nasogastric tubes. And here's kind of just showing a simple leaden tube with one lumen going into the stomach. Here's works cited. I use all my information from my chapter, and this is just where I got the pictures. Thanks for watching.